Today we're going to be talking about proper prep when it comes to clipping and cleaning for a spay of a female dog or a neuter of a male dog. As you can see, we are in my home once again. We are not in a clinical setting, so we are going to stretch that imagination in the world of make-believe again. Our beautiful charity bear is going to be our stand-in patient. We're going to assume at this point he is already prepped, so he's going to be tubed, endotracheal tube would be going in. He'd be sedated. He'd actually be positioned in a V tray, so he would be safe. He would not be tending to roll over or move around. And because he's also anesthetized, again, he's not going to tend to want to move around. At this point, if it's a female, we want to start by shaving the area from the xiphoid process, or the sternum, all the way down to the pubis. And then we want to go 1 to 2 fingers of either side of what would be the mammary chain. And in a male, we want to create the box. So we'd go just to the top, and then we'd clip all of the hair around the scrotum, testicles. We'd do the box, so 1 to 2 fingers each side. And when you start, you want to ensure that you inspect your clippers. You don't want any broken or chipped teeth. You want to make sure they're not overheating. And you're going to do your first pass with the clippers with the direction that the hair is growing in. And then you'll do a second pass against the direction that the hair is growing in. So the first pass with the grain, second pass against the grain. But you want to take care not to cut, not to create any razor burn around the area, or you're going to be compromising the field. Once the clip and that is done, you want to actually vacuum the area. If you have a vacuum available, get rid of all the loose hairs that are on your patient, as well as on your prepared tabletop. Once the vacuuming is done, it's time to move on to your wash, your scrub, and your clean. Now, ideally, you would want to use pieces of 4x4 gauze. I don't have 4x4 gauze. Again, we are in my home. I do have 1s. So we're going to imagine that these are 4s and not 1 inch. And you would establish, first and foremost, the scrubbing and the cleaning of the patient. This is, we're going to stretch our imagination again. It's going to be our chlorhexidine scrub, or in this case, because we're washing, the chlorhexidine wash. You're going to start by washing the patient several passes with your 4x gauze, ensuring that it is clean. And you're going to check by cleanliness by taking a final piece of gauze, final wash, and just do a strip right down the middle of the surgical area. Look at your gauze. If there's any appearance of dirt on your white gauze, keep going, give it another wash. If it appears to be clean, then we're going to move on, and we want to establish 2 stacks or 2 piles of gauze. 1 ideally consisting of 5, 1 ideally consisting of 4. 1 you would soak in your wash, next you would soak in your scrub. And what you would do is you would take your 1 off of your pile of your wash and do a wash in a nice circular motion, inside out. Do not cross over where you've been, and discard. And you would keep going, alternating between the 2 stacks. On your third pass, give it a look. If it appears to be clean, wonderful, discard. Take 2 more off and cover the surgical area. That ensures contact for a few minutes and a proper sterilization of this area. Now your patient is clipped. They are clean, they're sterilized. You want to make a final check, make sure they're reaching that surgical plane of anesthetic, and you want to do their final vitals, do their temperature, their pulse, their respiration, make sure everything is good. At this point, your patient is ready to be unhooked from the isoflame, whatever you're using, the oxygen, and transported into the surgical suite for spaying or neutering. Thank you so much. I hope you found this informative, and have a lovely day.